Hello and welcome to KCS Connects. My name is Jack Miller. I'm one of the co-directors of Key Clinical Skills. KCS Connects is our way of helping to connect you with some of the literature that we believe will positively impact on your clinical practice. This issue of KCS Connects comes from a paper published in Musculoskeletal Care just in 2021, and the researchers are from the Physiotherapy Department of King's College Hospital in London, UK. Is physiotherapist awareness, knowledge, and confidence in screening and referral of suspected axial spondyloarthritis. And this is a survey of UK clinical practice. A little bit of background here about axial spondyloarthritis. There's a couple of subtypes, the most common being ankylosing spondylitis. Now, the early stage symptoms are, first of all, the patient reports intermittent back pain. Often it's non-traumatic, often relieved by activity, not rest. And that's a good distinguishing feature between it and mechanical low back pain. Because of involvement of the sacroiliac joint, and if you look at the graphic over on your right-hand side, you'll see that certainly the SI joint is the most commonly inflamed area in this particular problem, followed not far behind by the thoracolumbar junction, as well as lumbar spine. There can be inflammation, tenderness in that SI area, and often the last cluster of SI stress tests will be positive in these patients. And all along with that, there can be reactive muscle guarding, so they can have increased tone through the paravertebral musculature, flattening the lumbar lordosis, internal loss of mobility throughout the thoracolumbar junction area. A little bit more background here about ankylosing spondylitis. A really useful clinical prediction rules developed by Rudawaith. It involves 4 different components: morning stiffness lasting more than 30 minutes, improvement of back pain with activity, not rest, like we mentioned before, awakening in the second half of the night because of back pain, and alternating buttock pain. Now, if you have 3 or more of those factors, that carries with it a positive likelihood ratio of 12.4. If we go over to the nomogram over on your right-hand side, you'll see that the pretest probability of ankylosing spondylitis, the prevalence runs roughly about 4 to 5% in the general population. We apply that 12.4 positive likelihood ratio, and what we end up with is a post-test probability of 40%. Now, another subtype of axial spondyloarthritis is often called reactive arthritis, and another name is Reiter's syndrome. And this is an autoimmune condition that often falls secondary to venereal disease infection. It involves anterior uveitis, so they report dry eyes, urethritis, urination pain with like a burning sensation, and often because of the insertion points of large tendons into bone and enthesopathies, these also become inflamed, and it can be mistaken for anterior knee pain as well as plantar fasciitis. Now, this particular study gave physiotherapists a series of vignettes, and they were to try to understand whether or not the individual would have a suspicion of axial spondyloarthritis, non-specific low back pain, or radicular syndrome. And you can see there that the ability of the physiotherapist to distinguish between these different vignettes was actually quite poor, wasn't it? Now, the clinical reasoning content of axial spondylitis arthritis awareness is, first of all, we should appreciate that even those individuals that were familiar, a good percentage of them had poor awareness of the clinical presentations. We also should acknowledge the fact that physiotherapists were not terribly good at acknowledging whether or not the individual should have further screening of the suspected spondyloarthritis patients, even for those who were familiar. Now, if you'd like to learn more about this particular paper, come visit us at www.keyclinskills, where you can get the full research review, as well as free access to roughly 65 other papers that we've reviewed for you. And if you'd like to learn more about axial spondyloarthritis, again, come visit us at www.keyclinskills.ca, where you can take our online recognizing rheumatology program that's been developed for you by Jack Marsh, a rheumatology specialist physio from the United Kingdom. Thanks for your time.